I have managed to sign two bills for which I'm very, very grateful to the Assembly through the leadership led by the Honorable Speaker and the Honorable Majority Leader and the respective chairmen of committees that have been responsible for the preparation and the approval of the Nyeri County Health Services Fund Bill 2021 and also the Nyeri County Inspectorate Bill 2021. Ladies and gentlemen, the Nyeri County Health Services Fund Bill seeks to improve the financial transactions and positions in our hospitals, more so within the county, the level 5 and the level 4, not even forgetting the level 3s and all the way down. What this bill envisages is a smooth running of the institutions, the medical institutions that I've just mentioned, where through its operationalization will allow for 80% of all funds collected within an institution to be retained within that institution. For example, the county referral hospital shall retain 80% of all funds collected within that institution, while 20% shall go to the satellite or the other lower levels that operate within the PGH or the CRH. And what does this one? This one will help us be efficient in terms of time taken and the rollover of especially the issues of procurement, the issues of fund clearances from CRF and all that. And so this is intended to improve the health services within the county because the institutions shall do their procurement at that level. They shall retain the money they collect at that level. And at the county treasury, we shall then be responsible for other operations of the health services, like, for example, the payment of salaries, the undertaking of capital developments. And it is also important to also say that this bill creates a management committee that will be at the county level, made up of chairmen from the various level 5, level 4 hospital, level 4 and level 5 hospital that we have within the county. And that team will be the central management board that shall control all the funds and ensure that these funds go back to the respective facilities. The second bill, which we have just signed and for which I'm also very, very grateful, is the Nyeri County Inspectorate Bill 2021. For quite some time, since the onset of devolution, we have continued to refer to municipal askaris as enforcement officers within the county, yet there was no legal provisions and there was no bill that regulates how they operate. And so this bill intends to give them powers to dictate how they run their affairs, also bring connection between themselves and the police, national police force in terms of giving them powers to arrest, giving them powers to enforce the county laws, which include operationalization of the various county finance bills, the inspection of premises in terms of licenses. And so generally what we are trying to do is ensure we have legality in what we do. It would be a tragedy for us to continue operating the way we have been operating since the onset of devolution, where the county has not had any legal provisions allowing for the existence of enforcement officers and also giving them the powers that are now so stipulated. So these, ladies and gentlemen, are the two bills that we have assented to. And like I said in my opening statement, is that I want to really, from the bottom of my heart, appreciate this county assembly and its leadership, because the numbers of bills, the numbers of policies that we have been able to enact within our lifespan had never been achieved. We are looking forward to maybe before the end of this week or very early next week to be signing 2 other bills, the climate change bill and also the forest regulation bill. All these are bills that have taken the personal interventions of the leadership, the chairman of committees, for whom I'm very grateful.
And as a county government of Nyeri, we are very delighted as we present to His Excellency the Governor 2 bills, as he has stated them, the Nyeri County Health Services Fund Bill 2021 and the Nyeri County Inspectorate Bill. I want to say that for the Health Services Bill, we are among now the very few counties in Kenya that have come up with this bill. I remember when His Excellency the Governor held a meeting with the MOH, with the Cabinet Secretary Mutahi Kahiga in Mombasa, together with all the other governors. One of the resolutions was that counties would come up with this kind of bills. But how many of them have been able to do this? I would say that we are among the top 3 in the country. We have been able to legislate, and as the governor has said, we are going to be bringing 2 other bills in the next few days, 2 or 3 days, and this is going to put us at 4 bills within a week. And this tells you that sooner than later, as a county assembly, we are going to probably be the best county in terms of legislation in our country. Why we are very proud of this health services bill is because it is going to help us as a county to ensure that we improve our services. The way I would like us to look at it is the way the water companies are operating. The water companies in the county are owned by the county government, but they run their own affairs, and so they don't come to the governor to buy for them chlorine. They know how chlorine is bought to ensure that water remains cleansed for people who use it. Similarly, we do not expect that the PGH now will come to the governor to tell him we do not have medicine, we do not have drugs, because the money they will collect, they will also go and buy drugs. So we now, our oversight is going to become easier. Before, we collected all the money and took it to Treasury. And then accessing that money was a problem. But today, when we now collect money, we will not take it to Treasury. We will be able to use that money without having to access or to go through the bureaucracy of procurement, of requisition, because now we have our own bill. We can be able to spend this money to give services to our people. So that is something that makes us think and believe that this bill is going to have a very serious impact in our community.